Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host for the Dean's Chat podcast. My guest today is a longtime friend and colleague, Dr. Eric Jaakola from Evergreen, Colorado. Dr. Jaakola did his undergraduate work at Fresno State. He received his Doctor of Podiatric Medicine from the Scholl College of Podiatric Medicine, and he did his residency at the North Colorado Surgical Residency Program in Greeley, Colorado. Dr. Jaakola currently owns the Foot and Ankle Center at the Rockies. He also is the medical director for the Rose Advanced Wound Care Center at Rose Medical Center. Welcome to Dean's Chat, Dr. Jaakola.
Thank you so much, Jeff. It's great to be here. I appreciate you inviting me on.
No problem. I know you've had a busy day. You were in the Wound Care Center. And
I still am, yes.
And you still are. That's great. I just wanted to share with our listeners and our viewers that you and I have worked together for many years, back when you were even a student at Scholl doing a clerkship at our program in Colorado.
Yeah, and it was because of you I actually became part of the program and got the residency. It was, back in 2000, where I started with you. You were one of my first externships. So I went from being an extern to now directing the externship here at the program here at Greeley.
I was going to mention that. Eric, I was going to mention, we're on Dean's Chat, so we go first names, Eric and Jeff, of course. But I was having some flashbacks the other day preparing for this, because I was doing a lot of biking back then. And you came in from Scholl, one of the early clerkship opportunities, and we were working together, and I had a spill on my bike and hurt my shoulder and my hip. And you basically ran the clinic, and I just kind of followed around and you gave injections, you were taking x-rays, you were doing everything.
And it was bad luck for you, but good luck for me, because so you saw something in me that I was thankful for, that I could be helpful and responsible. And I was so pleased that I could gain your trust in such a short period of time too. And that kind of leads me into, those are the types of things we look for in our students and residents.
Right. Well, let's jump into that. A lot of times what I do is I follow someone's career from when they first find out about podiatric medicine. But I thought maybe what we could do today, Eric, is talk about the North Colorado Surgical Residency Program, and then we'll go back and talk about your career a little more.
Sure. As they all are now, this is the North Colorado Podiatric Surgical Residency is a 3-year surgical program, as they all are now. It is focused or based out of Greeley in North Colorado. However, the residents do move around through most of the northern aspect of Colorado, from Denver to Greeley to Fort Collins, several different areas, which does involve a lot of driving, but it also involves a lot of experience with different attendings and different points of view, which I think is a great strength of this program. So I think a lot of programs will say we're really very diversified. We're well-rounded. I truly think we are, as a program, quite well-rounded. And we get that comment every year from our rotating externs. They say that's exactly what we are, and we're sought after for that matter, because you get to focus, or you get the ability to focus on different specialties within podiatry, because we kind of cover it all for the most part. The program is in the first year, they're going to get a lot of their didactic rotations done, not only didactic, but surgical. So they're going to do everything from emergency medicine, anesthesiology, general surgery, everything that all the programs are required to do. And I think we have a good cast of attendings who educate in all those areas. One of the benefits, I think, of Colorado in general is that podiatrists are very hand in hand with all the specialties. There's not any of this we're better than you or vice versa. It's very communicative between the different specialties, very approachable, and especially up in Greeley, the residents in podiatry are sought after because we typically hire people that are very hardworking and smart and willing to work and learn more and eager to learn more. And I think all the other attendings, the surgical attendings, the ortho attendings involved in the program, they contact our residents constantly. And I think our residents benefit tremendously from that.
Well, that's great. Let me ask you this question. How many attendings are there at the program?
Podiatry attendings, oh goodness. I think there's a core of about 8 to 10 of us that they see most frequently. And then we have another 10 probably that are the occasional, I guess you could say. But in all about 20 podiatry attendings, and then there are multiple ortho attendings, and then general surgery attendings that they work with frequently, because the residents will go through the ER up at, or even just the OR up in Greeley, and they can kind of just skim and see what's going on at the end of the day. If somebody's doing surgery, looks interesting, they'll just volunteer and go in, and for instance, the general surgeons will get used to them saying, hey, you need any help with retraction or something, and then that gets their foot in the door, so to speak, and then they get asked to come back, and then they get asked to help, and then it's a snowball effect, but it really benefits our residents, and I think our residents stand out that way in doing that. And they just get a great education that way, seeing all aspects.
Oh, that's great. Every year our students are signing up for clerkship opportunities. And of course, they're looking forward beyond that to potential residency opportunities. And I've got such great feedback. We really appreciate all the clerks you take at the program. Can you give a kind of an overview of what a month at your program would look like from a student's perspective?
Sure. It's certainly a 5-day a week or more if they choose. Where the weekends there's always something going on. Resident's life is never ending, and the clerk or the student can tag along as much on the weekends as they like. But during the week, they are assigned essentially on a weekly basis where they will go. They're usually going to follow a resident, and let me back up and say the resident schedule is based on the surgery schedule amongst all the attendings. So the surgery schedule comes out on the weekend, and then one of the residents will assign the cases to each of our residents. And then they'll assign a student to go along with residents, or if there's not a case going on, they'll be assigned to a private office or a hospital wound care center or a hospital rounding. Or every week we have residence clinic, which is a solitary residence clinic where that's all there's residents that are running it and students helping out. So that residence clinic is a great opportunity to learn to make your own decisions. Sure. And not rely on an attending. So it just forces you to think a little bit more. So the basic week is they're going to go to different aspects, different locations of where the program attendings are, assist or observe or do surgery with that attending. And then, for instance, in my office, if we do 1 or 2 surgeries, then they would come back to the office with me and see clinic patients for the rest of the day. And then we do didactics during that course of the time. I would say we're definitely not a pimping program, but we ask pointed questions. And I think one of my favorite things to do is see when a student or a clerk will take a question from me. They may not know the answer, and that's fine. It's always fine. But I'm really impressed if they go back and they look it up and they maybe even write something up and email me the answer. And that is a tremendous amount of initiative. And it happens quite a bit. I'm really happy, obviously, when that happens. So to go on, we will also have the externs do a project. They have a lecture that they need to give, so they're assigned a topic at the beginning of the month, and then they have that month to look up, put together their presentation, and then they present it to Dr. Bardal or Dr. Hatch at the end of the month. There will be a little bit of a cross discussion at that time. And the focus really on the whole thing is, does the student enjoy what they're learning and how they're learning with us as attendings? And then vice versa. Do we get along with them? It's like a large job interview.
Right, absolutely. I think it's great that you have them research a topic and present it, because they become an expert on one topic.
That's right.
And they can use that in the future also. So I think that really works well for them.
Yeah, begin their collection of PowerPoint lectures, because they come in handy.
No doubt. So if you were to share some qualities of your residents that you're looking for and those that come to your program, what would those qualities be, Eric?
I was thinking about this today before this, that they're qualities that I want to, like a friend. Of course, we got to have the didactics. They have to have the GPA. They have to meet all the milestones, of course. But then it's, do I want to work with this person, and do they want to work with me? Do I trust them? If I send a student or a resident into a room to work up a new patient, for instance, do I trust them being in the room with my patient, my private office? So trust, hardworking, but not overdoing it. Some students get maybe a little bit too overzealous, and then it just comes across wrong. And I think you know what I'm talking about, but it's hard to pinpoint how to describe that. Teachable, of course. They need to be able to accept and take criticism, because that's what this is really all about, is learning. And if they can't take the criticism or take the teaching point, then they're just not teachable. And then I was thinking about this, that one of the things I look for is background. Are they all 100% didactic coming in? Did they just go to school until this point? Or did they have a job? You and I used to say, we're looking for that resident that had a construction job or something with playing a musical instrument, or they know how to play pool real well. And looking for those hand-eye skills in different ways. So that's something I'm really focused on and looking for. Diversity too. So not just didactic as far as podiatry, but do they have other interests, and can their mind be expanded?
Right. Well said.
I don't know if that's...
No, I love that. What's interesting about that, Eric, is we're looking for the students and the residents whose eyes and mind can tell their hands what to do.
Yes.
And it's hard to teach that sometimes. I mean, with time and with repetition, you can get that.
Right.
But there's obviously very special students that we see that we would like to be residents, like yourself, and really are very successful with it.
Well, you and I both know, we went through several residents where they started out not so great, hand-eye. And, with work, that's the teachable part. If we know they can do it, we just got to give them the time. And maybe, pound on them a little bit, suture every day.
Right.
And that's one of those things that most attendings when I was going through said that if you can suture, you can probably cut. So if you go in your first day and you can suture well and suture efficiently, you're probably going to get the knife the next time.
That's a funny story, because at our school, Eric, we've got the suture off. It's a competition among the students.
Oh, good.
In their intro to surgery course. And then we actually have a playoff at the end. The top 8 sutures come in and we have a big competition. And I always tell the winner and even the second place person, I said, that belongs on your CV, because
I was about to say, yes.
Can you imagine saying I was the best suture in my class, and that's your foot in the door sometimes.
Yeah, I do the interviews every year in Frisco, Texas, and one of the things we do bring is some suture, and just see how their hands work, suturing up some felt or something, just to see what they're doing.
Yep, it's always good to ask them questions while they're doing something, see if they can think and work at the same time. That's fun. I've really had a lot of fun, Eric, over the years, looking back on our residents and seeing how successful they've been. Just a side story, I was in Texas for my son's graduation from Baylor, and where we were staying was across the street from this beautiful building, and it was a foot and ankle center, and it was Neal and Willingham's.
I knew you were going to say that.
And so I went over and I went up to the front desk and I asked if Dr. Willingham was available. He gave me a tour of the whole place, and it was just awesome. So I'm so proud of our graduates of the program over the years.
That's great. I just recently sent him a patient I knew was moving to that area. Yeah.
Well, another one of our residents, Christine Hoffman, is now running the program over at Denver Health.
Yes, and so successful. She's wonderful. She's doing a great job. I just sent her a patient just last week and got on the phone with her. Yeah, it's we do have a great alumni. They're really doing great things, and it's so satisfying.
Absolutely. All right. Well, I know that our students love coming to visit, and I know that they're all vying for the residency opportunity. So thank you so much for all you do for not just the students in Arizona, but from all the schools around the country.
Oh, yeah. Yeah, when I was starting off, I thought I'd really want to make sure I stay part of the residency program because it keeps me on my toes, too. I can't ask questions else. I know the answers. And I think that's part of doing this.
Absolutely.
For me too.
Oh, I remember that. You got to stay on your toes. Students are bright. They're super smart. And when you ask them questions, they know the answers. And if they don't, we train them up, right?
Yeah.
So, Eric, let's shift gears a little bit. Let's talk about your podiatric journey. One of my goals in doing the Dean's Chat isn't just to, talk about residency programs. I like to get to know, the docs that I'm interviewing and find out how you found out about podiatry. And you and I had a very similar path. We got an undergrad, started a master's program in exercise physiology, and then pivoted to podiatry. Can you share your story, like when you found out about podiatry and when you said, I'm going to be a podiatrist?
Sure. I probably sound like a broken record on your Dean's Chat because I've listened to multiple of these and they all say, well, I had no idea about podiatry when I found out when I started. And the same is true. Yes, I did my undergraduate and then I went to graduate school. I was working on my exercise phys and my focus was to be moving on, going to do a PhD and a college professor. And that was my goal. And then I had one of my professors pull me aside one day and asked if I was interested in medicine and specifically podiatry. And it was the same, well, what's podiatry?
Right.
So she had me shadow with a local podiatrist that had done the exact same thing, started the master's, was working in the master's program, found out about podiatry because of her. And she had a friend, one of her best friends was a recruiting agent person for Scholl. And so she was kind of always on task to find somebody else that would go into podiatry. And I was that one. So yes, I shadowed with a local podiatrist in San Luis Obispo, California, and really enjoyed it and ended up applying and getting in straight away. I got into multiple of the schools, but I ended up going to the Scholl School in Chicago when it was downtown. And it was in, my third year that started looking for where you're going to go do your residency, and your program came up as it was just starting, and you and Dr. Hatch, and so I applied. You guys accepted me to do the externship, and it was then to go back to your bicycling story. I was in my first month, which was in my third year. Transitioning over to the fourth year, you got in your accident. I was supposed to go to another program, and you knew Dr. Todd pretty well
at Scholl,
and asked a favor, and I asked the same favor, and that's what got me to stay for the extra month and help out, which was to my benefit. And so that obviously snowballed down to I applied for the residency and fortunately got it. And I was the first resident here at the Greeley program to do 3 years. There was one resident ahead of me that did 2 years. I did 3 years. And then Anna behind me, who's my partner now, as you know, she did 3 years as well. So you offered me a job straight out of residency at the office I'm still at.
Right.
And I've never left. So I've been here now from residency 2001 till now, but graduated residency 2004. But Rose Hospital is all I've ever known.
It's incredible. You met your wife there too.
Yeah. Julie was a volunteer in the PACU. And as you know, you and I were doing surgery one day, and one of the other nurses came in with almost the high school, "Hey, somebody likes you," handed me her number, and Julie probably tells it differently, but yeah,
I vaguely remember doing op reports and things while you were out flirting with her at the nursing station. Yeah.
Yes, yeah, that's right. Yes. So, and then from 2001 on, becoming the resident here, then I was always involved in teaching the students as they came in. So I've been, involved in not only selecting the new residents and students since 2001. So
yeah, it's amazing how fast 20 years goes by. It's truly amazing. Hey, Eric, I just had a thought. Tell a story about when you were scuba diving for work and scrubbing the bottom of yachts. Yeah, that's a great story. Because, when you told me that story back in the day, I thought, yeah, this young man likes to work and he's going to work hard. And share that story. That's just great.
I was so a little bit of background. I was the first person to go to college, so let alone all of this. And so in my family, and had moved to Colorado to be a ski instructor and did that for a season. Then I went back to California, moved in with some roommates and got into a junior college, which you don't get into, you just walk. And so I'm, a starving student, and I found this job. I had learned to scuba dive because I won a radio program call in, and got to go to Hawaii, learn to scuba dive, that type of thing, just on a prize. So that got me involved in diving, and I met this guy who was running a dive shop, and he asked if I wanted to work as a diver. And the job was to you wear, it's in Oxnard Harbor, so it's not the warmest water. So you wear a 6 millimeter Farmer John wetsuit, and with a hood, the gloves, the hoodies, everything. And it's thick, heavy, but warm enough. And then you go out on a skiff to these huge, 80-foot, 150-foot boats, and you take what's called a hookah rig, which is a 50-foot line to your respirator, and you go underneath the boats with a suction cup on one hand and a scrub brush on the other, and you scrub the entire boat. And this could take anywhere from 2 hours to 4 hours. And then you're also replacing the zinc. So you're working with tools and replacing the zincs on the metal. It was exhausting work underwater. And you're doing this motion against the water resistance, and it is just exhausting. You're sweating your butt off. But at the time, it was really good money for a starving college student. But that was an experience in hard work for sure.
To this day, that's the most interesting job I've heard from a prospective student or resident. So I thank you for sharing that. So Eric, you've had quite an eclectic career, because we did a lot of clinical trials in the 2000s.
Yeah.
You worked with the NIH as a reviewer for musculoskeletal group. You and I did a lot of product development back in the day with NIH grants. Right. And then you've been lecturing and consulting for companies. What do you see coming down the pike in podiatric medicine? What have you seen, whether it's surgical or non-surgical, that can advance the profession?
Because there's kind of multiple genres, right? There's the wound care aspect, and there's always something new coming about in wound care. And I see it eventually becoming dialed in, where you're going to be able to take some blood from a patient, know exactly what antibiotic is going to be appropriate down to the milligram of the antibiotic and which antibiotic, and it's going to be that focused. I think that's coming. The wound care products will continue to evolve. We've gone from, collagen stuff up to amnion, chorion, to fish product. I mean, there's all kinds of stuff. I don't have one in particular thing in product-wise because there's just so many. But you probably know more about this than I do as far as what's the next big product out there. Nitrogen release, all that stuff is big. Surgical, gosh, that really keeps evolving. What I would love to see, and I hope it comes, and this is in the wound care realm, is something where when I'm doing a partial first ray and I need to get a clean margin, and currently we cut the bone, we take a little sliver of bone, we divide it, send it off to pathology and culture, and then we twiddle our thumbs and wait and see, did I get it all or not? And that could take 1 to 5 days, I've seen it take. And it's a little frustrating. And I feel like there should be, and probably will be, some sort of light like they do at the dentist where you can flash it on the bone and you know that you've gotten rid of all the bone infection in that bone to that level.
Right.
That's what I would like to see done there. The replacement parts, I think, are common and are here. They're, the fabricated 3-dimensional talus. Maybe they'll do a calcaneus. Of course, they're already doing metatarsal. Those I think are going to get better and better. The ankle joint replacement has really evolved. When I started, back in 2001, we were doing them, but the problems, the problem rate was 90% of having a consequence, an infection, and now it's what, 1 or 2%.
Right. No, there's no doubt. It's amazing how fast time flies too, because you mentioned that I would know better than you, but Eric, I've been out of practice since 2010. That academic.
You're on the pulse.
A little bit, maybe a little bit. So let's shift on a little bit. Let's talk about your current situation. You joined multiple doctors on the Front Range to develop a large group of podiatrists. Tell us how that played out and the benefits.
So, yes, currently we are that Foot and Ankle Center of the Rockies.
I like it.
And that is our group between a Greeley office, Longmont, Denver, Aurora, Frisco, and Evans. So about 8 or 10 of us. And we operate independently as offices. So where there's no dictation as to you have to do this, or you have to do this. We still operate independently. And then we operate under a much larger group, Ankle and Foot Centers of America, which is a group primarily based out of Atlanta. And they are our kind of operating system, if you will. They're the ones that we collaborate with our ECW, the program you put all your notes in.
Electronic medical records and
electronic medical records. And then they offer us our billing. So they take care of our billing. And then we pay them a percentage of income to do all these things for us.
Oh, so they don't own you.
Management.
They don't
own
you.
us. No. We pay them to manage.
Oh, okay.
And so we get benefit from that with not only billing but purchasing with our management. So we have, instead of an office manager, we have a back office manager, we have a front office manager that circulates amongst the offices here in Colorado.
Okay. That sounds efficient.
I think it is. I think it really is. And it's a great way to do this. And it's efficient. It's functional. It takes some of the like, I always hated the hiring firing thing.
Sure.
That's something I never like to do, and that's completely out of my hands, which is in a way great. I mean, I get to work on the hiring because I get to interview and see who people are. But
well, you get to do what you're an expert at and what you're trained to do.
Right. Yeah. And And they certainly help out with the billing and the efficiency of billing. And I was never a great coder. So they certainly pick on me for that, which is great. They keep me in line and give me the latest and greatest of what I should be doing.
There you
So I think
go.
that's helped.
Okay, very good.
Because ultimately it does come down to we need to make money to stay in business, to keep treating people. So if I don't do it efficiently and well, then I'm going to starve.
There you go.
Lose employees.
There you go. So Eric, you probably noticed this from some of my other Dean's Chats, but I've been talking about work-life balance with a bunch of different doctors. And it's so important. And because when I'm interviewing students or even current students at the school, they're always wondering, what's it going to be like in practice? One of the reasons I went into podiatry was for a work-life balance. And you exhibit that. I mean, you and I have done a lot over the years, from golfing to fishing to going to Alaska. Talk about things you like to do. You're also really into biking right now, right?
Yeah. I think the work-life balance is great. I currently work 4 days a week. Anna and I both chose to do that about 6 years ago, just go down to 4 days. They might be 4 10s or 12s, but that would have been 5 days too. It's just how things work out. But yes, I really enjoy my kids a lot. I have as you know, my 14-year-old and a 9-year-old, and that's a lot of my focus when I'm off and doing things with them, from biking, mountain biking, hiking. We moved to Evergreen a few years ago, or 2.5 years ago, and getting to enjoy that space now is just fantastic. Traveling, getting to get the kids out. We like to take them on vacations where they get to learn stuff and enjoy different cultures. Cycling, yes, you bring up cycling. I have gotten, you kind of really introduced me into road biking because I had done one ride with you right before your accident.
Oh, I remember that.
And with the altitude, I couldn't do it. So it was kind of I need to be sure I do that. So since then, I've done, the triple bypass, the ride here in Colorado a couple times. Copper Triangle. These are big, 60 to 120 mile bike rides.
For our listeners, Eric, not everybody's from Colorado. Can you tell what the triple bypass is? That's such a great name, right? But it's truly a aerobic endeavor to the extreme.
Yeah. So the triple three bypass is 3 passes. So we have 3 major passes that you go through. You start in Evergreen and you go up Scholl Pass, which goes to about 11,000 feet, then down off the back into Idaho Springs, back up to Loveland ski area and up over Loveland Pass, which is another 11,000 feet, down back of Loveland in through past Keystone, through Frisco over to and going up to Copper ski area, then up and over Vail Pass, then down Vail Pass through Vail and into Evans area. And so it's about 120 miles, just a short little jaunt. And it took me 9 hours, I think, the first time I did it, and 7 hours the second time I did it. And I'm signing up for this year. Anna and I and Eric Thielander have pledged that we will do this year. The hiccup in mine is that I'm having my knee replaced in 2 weeks. So
you told me that.
Now I have a little bit more motivation.
A couple things about that. One is I think about the triple bypass and I think about the hard work going up those hills. But how fast you get going on the downhills, it almost sounds terrifying to me.
I agree. I'd much rather climb. I enjoy the climb. The downhill is sketchy, especially that first Squaw Pass when you're cold. It's pretty cold, even though it's June. It's early in the morning. I bring gloves because it gets really cold. I have a bit of Raynaud's, and so my hands, I lose sensation. It's hard to grasp those brakes sometimes. And you can get going 60 miles an hour easy.
Right.
And there's some corners on the backside.
Absolutely.
So the downhills I don't like as much.
No, I'm with you. Speaking of your knee, I'm going to bring back an experience. when you were a resident, you had been a ski instructor, and my boys were like, 7 and 5 or something, and they wanted to learn how to ski, and you were kind enough to give them some lessons. But on the last run of the day, they wanted to drink hot chocolate, and you and I went up and took a steep black route down, and I was behind you, scared, watching you, and your body went in one mogul and your leg went in the other.
Yeah, it wasn't pleasant. That was at what was it, Loveland?
Yep.
Yeah, Loveland ski area, and it was just a little bit harsh condition. Yeah, and you know it when it goes, and then unfortunately, I had surgery as a resident and had it fixed. Had the cadaveric graft because I needed to get back as soon as possible. And then like 2 years later, 3 years later, happened again. Although right after I had it fixed, you and I did one of the many Susitna runs with you.
Oh, yeah. I mean, we went up to Alaska with Ken Greenberg, and Dr. Greenberg is an infectious disease doc at Rose Medical Center. Yeah. And the three of us went about one of those survival races.
Yeah.
We survived, but not by much.
Yeah. Well, I remember I only made it 80 miles because my knee gave way. There was so much slick ice that year because it was a warm year. And so running across that lake, I kept slipping and it kept just jarring my knee. And yeah, by the 80th mile, that was a checkpoint and I could check it out, and I had to.
There's something wrong with saying I only did 80 miles. Well, I was telling my office staff today because I was preparing for this interview, and I said, I'm going to interview my ex-partner, Dr. Eric Jaakola, and I was telling the story of when you and I went down to, in one of our office meetings, we went down to Cabo, and I'd been trying to catch a marlin on multiple trips, and so I caught one marlin. I was exhausted, cracked a beer. You caught like 3 or 4 that day, right?
Well, just 2. But yeah.
But you had the one to the boat. Remember that Brock broke the line?
Right. Yeah. Yeah. Wonderful. That was such a wonderful trip. Gosh, that was so fun. We had, besides marlin, we caught so many. How many coolers did we bring home? Full of fish.
Yeah, it was full, no doubt.
Yes.
So I'm also I'm going to tell a fun story about that trip. For me, it was kind of funny, but you ate that mole and you weren't feeling good.
Oh, no.
And then when we got home, we went through customs, and we're in the car going home, and you go, and I remember you were just out, you were not feeling good, and you said, I forgot those Cuban cigars, but the customs didn't find them either.
That's right. Well, do you remember why we ate the mole? Is because I think it was me. I screwed up on the flight reservations coming home. So we were supposed to come home in one day, and we get to the airport, and we look at our tickets. We fly into Mexico City, but then have a layover overnight in Mexico City, and we had to stay the night in that hotel at the airport.
I remember.
And so we were looking for food, and that's why we ate at that restaurant.
I know. I remember watching you eat that mole, thinking that's not a good thing.
That's no, I can't do that ever again. Kind of like tequila.
So, Eric, what's on the horizon professionally for you going forward? I know you're going to be getting your knee replaced and you're going to be biking a lot, but how about professionally? What are you looking at? We just expanded the office. So I think I told you I finally moved out of that office that you and I were in. We moved across the hall over to Dr. Cooper's office. So we have 3 more treatment rooms. It's a bit bigger office now. We hired another podiatrist who just finished fellowship, and she's been great. It's fun working with her. We're actually doing a Charcot reconstruction on Friday together. Great.
Growing the practice, continuing to grow the practice. We are looking at purchasing practice. We just went and evaluated a practice, but didn't work out. But we're looking at just continuing to expand. Maybe if we can purchase another practice, then we can hire new grads and start or keep moving up, keep moving forward.
You know what I've noticed, Eric, when I go back to Denver, it seems like it's doubled in size the last 12, 15 years.
It has. There is certainly room. Yeah, there's plenty of work here. And we want to keep that going. I'm never going to be selfish and say it's my territory. No, there's plenty to do, and if you do the right thing, if you're good at what you do, you don't need to worry about territory.
Nope, I'm with you.
It's going to come.
I'm with you. So a couple weeks ago, you and I and some of the residents went to Regis University, and we did a student recruitment event. I thought that was really fun. Gave talk, and you brought in all the pig's feet, and we did a suture workshop. That was so enjoyable. Eric, what would you tell a prospective student that's considering a career in podiatric medicine?
That this, obviously it is a medicine career, and get all your ducks in a row. Do the proper things with regard to your education to prepare for it. Don't take it lightly. We need really good students to propel this profession forward. The profession is wonderful because you get to go to podiatry school day one knowing what you're going to do when you graduate. Unlike allopathic or osteopathic medicine, where you may get to do exactly what you want. Your mind might change. But that was something that steered me a little bit more towards podiatry when I found out about it. It's that, day one, you know what you're going to do. And it's great to be hands-on. The career is so, you get to see it and fix it. It's very satisfying. So that's something I would tell a prospective student is this is a satisfying medical career, which is hands-on. If you like working with your hands, the surgery is fantastic. You get all the camaraderie with all the other physicians. It's a great work-life balance because it's not like, not to say ortho is bad, but ortho, they do a lot of call. And if you like doing it, that's a wonderful place to be. I liked it initially, but now I'm kind of, I like not having to do so much call. The payment that, we get paid very well for what we do. Gosh, I feel like it's overwhelming how much I would say good about this profession. With the only one drawback, and is with every medicine career, is notes.
Right.
If I could do all this and not have to do all the notes.
Right. It's funny. I was doing a Dean's Chat with some docs that are coaches. They're coaches for physicians that are burning out, and they were telling me the number one reason for burnout is the advent of the electronic medical record.
Oh, yeah. Remember when they said this will make things so much easier, better, faster?
Yeah.
And quite the opposite. It takes much longer.
Right.
Remember when we were handwriting notes or dictating into the phone in between? Well,
at one point we had those touch screens. You remember we were working on them, and it was like one of the first computer programs. And the problem is you get to the medication list and then you're typing them in.
Yeah.
So, all right. Well, that's fabulous. All right, Eric. Well, I wanted to thank you for taking time and jumping on Dean's Chat and talking about the residency program and the clerkship program. And it's been fun to go down memory lane with you.
Yeah, very much. Yeah. Thanks so much, Jeff.
No, it's my pleasure.
Always good to catch up.
Always. And, Eric, I'm going to send you one of these Dean's Chat cups. I'll send you a few of them for the office so that everybody has them.
Oh, we'll love it. Yes. I was hoping you'd say that.
Yeah. Well, I know you drink coffee and you need to get some caffeine when you're doing those long bike rides. So
that's right.
And and to all of our listeners out there, if you're listening on Apple Podcast or Spotify or Google Podcast, please give us a 5-star rating. But if you're on YouTube, please become a subscriber. And until next week, everyone, cheers.